Welcome to the Byja radio show. I'm your host, Dr. Byron Jasper, and we are recording live from J. Kinba Executive Suites in Baton Rouge, Louisiana, with special production by Becnel Media. And we are back, and Patient Zero coming in hot with some more of the amazing music for the intro. I don't know where he's getting it from, but he's doing an amazing job, as always, bringing us in on a positive note.
Well, you know, I'm trying to channel in my inner Manny Fresh. You know, Byja Radio taking over for the 99-2000 or the 24-25.
The 2425.
The 2425.
I like it. I like it. We may need to trademark that. So
we need to.
Well, we are back on, I believe, episode 18.
18, and we haven't been canceled.
18, and we're still rolling, man. So that's a blessing. And I say that because, again, we keep getting messages from listeners who just tell us that either one, they heard some of the things we mentioned, for better or for worse. Right. Some things they also tell us are, hey, I got a shout out on there. And then we're even quoted in meetings. So I would say, look, we're having an impact one way or another. The hope is that it's a positive impact.
Well, you know, maybe more people are getting healthy as a result of this radio show. Hey, or at least people are like quoting people so we can sell some merch.
There you go. In that order.
You sell some merch.
Yeah, I understand. We'll get back to the merchandise in a moment, but I will say that I'm pretty sure 95% of people are actually getting better with us. So all of that being said, we are talking about possibly a heavy topic today. The topic we're talking about today is relevant to UnitedHealthcare CEO incident, where that person had an unfortunate basically encounter is the best way I'm going to say it. Most people know what happened.
Yeah, unfortunate encounter. It's very unfortunate.
Yeah, very. The worst thing I can say, or I'm willing to say, I should say, is that it is not necessarily something we want to glorify or highlight that somebody lost their life. That's never something we want to do in this type of program or any type of setting. So we're not really going to focus on that piece. But what I think a lot of people are surprised about is how that actual incident opened up Pandora's box about healthcare in general and a lot of the frustration a lot of people have with the healthcare system in the United States. And some people were very surprised and saying, well, how could this actually be a cause for someone to do something so heinous? A lot of people were very much sympathetic. They were like, look, we kind of understand where the frustration comes from. So with that being said, we're going to dive into the latter part of the incident, which is why people are so frustrated with the healthcare industry, namely the insurance industry in the U.S., on episode 18.
Sure.
So based off of that, what we're talking about today is basically why the system is broken. So we'll start by just talking stats. We always like to kick the show off with some stats, and I'm going to throw it to Patient Zero for the very first stat at the very, very, very top of his notes. So Patient Zero, what do you know about the spending in the United States?
Well, according to my notes, Dr. Jasper, last year the United States spent about $4.8 trillion in healthcare.
Okay,
and that's a lot of bread. And what that tells me is that I've wasted most of my adult life in telecommunications because I should have got some of this money some way, some shape or form.
You should have went a different route, is what I'm hearing.
Oh man,
okay.
I'm pretty sure they ain't spent that in telecommunications.
They did not. I'm going to go pretty much on a limb and say that it's a pretty strong limb at this point that, they didn't do that. So 4.8 trillion with the T, and trillion is a very interesting number. So to put that into perspective, if you added up the 10 richest men on the planet, they still, with all of that combined income, wouldn't reach half of what we spend on healthcare in just 1 year.
Jesus Christ.
So 10 richest men on the planet, add all of their income and net worth together, it's still not even half of what we spent on healthcare in this last year. So that should give you some insight into why a lot of people are, number one, very upset, but number two, just basically surprised at why are we spending so much money. So going into a little bit more in detail, the 4.8 trillion was in 2023, and 15 to 18% of the U.S. GDP, so one in every $6 is spent on U.S. healthcare. So one in every $6 is spent on healthcare in the U.S.
So I got a question for you.
Yes, sir. Yes, sir.
What is considered healthcare? Obviously, medical treatment, doctors, hospital visits, urgent care clinics, things of that nature. Like, that's obvious, right?
Correct.
But like, are we considering pharmacy runs, Band-Aids, over-the-counter medicines, Neosporin.
Yeah.
Is that considered healthcare as well?
Yeah. So all those things are lumped into this number, right?
Okay.
So not just the visits, not just the medical care that's administered by the physicians and the psychiatrists, psychologists, the social workers, but the medications,
Sure.
but the imaging, the procedures,
Yeah.
the ambulance rides. All those things are considered healthcare expenses. So all of those things are lumped into that one in every $6, that $4.8 trillion. Now, this is the best part of the research that we have done here at Byja Radio. And I'm going to say that because I smiled when I saw this, and it was very much the sarcastic smile that I like to smile when I see certain things, because it's more of a, aha, I knew I was right, I'm not crazy moment. So what in that sentence of healthcare spending do you believe these dollars are going towards overall? So we talked about the myriad of things it could be. It could be ambulance rides, it could be medications, it could be procedures, it could be surgeries, it could be physicians, it could be social workers, it could be co-pays, it could be deductibles. What do you think, Senior George, that the healthcare spending goes to at the top of the list when it comes to the healthcare industry? What jumps to the top of the list?
So, I'm going to go out on a limb, a very short limb,
Very.
but I'm going to go ahead and say 73% of healthcare spending goes on administrative expenses like billing, claims processing, and paperwork.
Yeah. I'm going to say you're spot on. And I think that is number one, it's in your notes, which I appreciate the fact that you read the notes.
Reading is fundamental.
There you go. But I also laugh because most people, if you say, well, how much spending happens in healthcare, people think a lot. That's a no-brainer. But then when we say, well, who do you think gets all the money? The immediate answer most people think is the hospital or the doctors. That's the two things that jump to the top of the list. Everybody automatically thinks hospitals are profiting enormously and doctors are right behind them. Or some people think it's the other way around, where the doctor takes all the money, the hospital gets the second amount, and then that's it. So what we see often happening in the industry is that insurance oftentimes gets absolved of a lot of the problems. They automatically are thought to be just this absent figure, and they don't have any say-so in what is being done or what's not being done. It's usually the doctor or the hospital causing all the problems and wreaking all the havoc, the patient's getting the short end of the stick, and everybody's just sitting back wondering, well, why is it that the hospitals are getting richer, the doctors are getting richer, and then there's pretty much all this spending happening? Well, a lot of it is because healthcare administrators, the people who are doing the billing, the claims processing, the paperwork, the people in the middle of all these transactions and equations are often the ones that are driving up the cost. And a lot of people don't like hearing that, but we'll go into more numbers in a moment. But I want to say that out of that $4.8 trillion that we talked about, health insurers reported a $25 billion net profit. $25 billion in profit out of $4.8 trillion spent. Okay? Now, I want to make sure I'm clear on this. If you know anything about accounting and anything about numbers and math, and we already talked about if you don't like math, you don't like money.
Thanks.
So when we say $25 billion, we're not talking about gross. We're not talking about what came in the door.
Talking about net profit.
Net profit. So that means they made more than that, and they took home $25 billion.
Correct.
So again, out of the $4.8 trillion that we're spending that are going to every single thing, $25 billion goes into the pockets of people on the insurance side. And that is mostly the administrators. It's not the physician. It's not the hospital. It's not the social worker. It's not the people driving the ambulance. It's not all of the people at the pharmacy. Believe it or not, it's the administrators that are basically taking home bank. And most people will say, well, I hear you, but I'm not sure I believe you. Well, before we go into numbers that drive this point home, let me ask the follow-up question. For all the spending that we're doing, George, where do you think America, the United States, actually ranks in terms of health? And again, we don't need to actually say a number. I don't want you to say, oh, it's number 5 here or there. Do you think we're at the top in terms of healthcare outcomes, toward the middle, or toward the bottom when it comes to healthcare outcomes? In terms of, hey, we're spending $4.8 trillion a year. $4.8 trillion a year. Do you think with all that money we're spending, we're having the best healthcare outcomes, middle of the road, or we're at the bottom?
If I had to guess, I would say middle of the road. Yeah, I didn't see it in the notes.
That's okay.
But my guessing would be middle of the road because I would assume that we are behind some other advanced countries, but I'd also assume we probably better than third world countries.
Gotcha.
So I'm guessing middle of the road.
Middle of the road. So a lot of it is dependent on who you're comparing it to. But if we are being as specific as possible, despite us spending $4.8 trillion a year, the U.S. ranks last in healthcare outcomes compared to 10 other wealthy countries. So if we're comparing us to the other wealthy, very well-to-do countries across the planet, we're often last when it comes to healthcare outcomes. So things like life expectancy, maternal health, diabetes, maternal mortality, fetal mortality when people are basically giving birth, we're often either last or at the bottom of the list. So we're spending the most money and having some of the worst healthcare outcomes, and yet everyone is sitting there thinking, hey, hospitals and doctors are the ones that's causing the problem. Insurance is just kind of there floating in the wind, not actually doing anything. Yet the people who are making the most are the ones that have little or nothing to do with the actual health care that's being delivered. They're not in the exam room. They're not driving the ambulance. They're not giving the therapy. They're not administering the medicine or checking them to make sure that there's no drug-to-drug interactions. They're often literally in an office somewhere making policy decisions. And those policy decisions affect you as a patient, me as a physician. And at the end of the day, we don't really have a say-so in it, but we're often the ones that are having the most problems. And that's the problem that a lot of people had when this actual incident happened. It opened up that box of, well, I have a story about something that happened to me where I spent all this money on insurance, whether it's a premium, a deductible, a procedure, and I did all of that and I still had a bill on the back end and I don't understand why. Right. Or it was denied and I don't understand why. Yet we're spending more and more and more because premiums continue to go up and we're still having poor outcomes. So it really doesn't make sense. And does that sound like a good system to you where you're spending a lot but getting a bad outcome and then they keep telling you, well, just give me more money?
Yeah, that doesn't seem efficient at all.
Would you say that that is a system you think should continue to go in that direction if that happened in any other industry?
No, absolutely not. But it's going to continue to go in that direction because of all the profits.
Absolutely. Now, the people who are driving the profits are the ones that think the system is fine. Or, hey, it's not okay, but, we're working on it. But the working on it oftentimes is very slow, very delayed, and very methodical to continue to go in the exact same direction that it is. So you'll hear people often say the system is broken, and I'm one of them. But you'll hear some other people say it's really not broken. It's working exactly like it's intended to.
I was about to say, because if you're telling me I'm making $25 billion in profits, I would say there's nothing about it that's broke. Yeah, I would say it's working fine.
It's working just the way you want it to, and it's going to continue to work that way. And why is it going to continue to work that way? Because the people who are sitting at the table are literally saying, my shareholders are happy, I'm making good money. There's really not a problem where people are trying to make drastic changes. So we're just going to keep going in the direction we're going in. And then something like this that's very polarizing happens and a lot of people start to speak up. So now it's we do understand there's more of a problem than we previously thought and we need to kind of make adjustments. Well, I think they've known all along there's a problem, right? You can't say to me that you're spending 78% on administrative cost. The people who are needing the healthcare aren't getting it. The people who are administering and delivering the healthcare feel frustrated, and no one thinks there's a problem other than the people who are calling the shots don't want to actually listen to that, right? And there's more to it, to the story, but that's the general concept. We're spending a lot. We're getting bad outcomes. The patients are suffering. The doctors are getting burned out. And then the people who are in the middle that sit in the office suite that are basically calling the shots are thinking everything's fine because they're profiting and laughing all the way to the bank. So we're going to go into a little bit more detail. And one of the things that I want to talk about is basically the idea of how this billing system works in a little more detail. So George, I'm going to ask you some questions. And some of these questions are very simple, very straightforward, but it's going to get a little complex. And I know you're going to follow because you're really astute, recent graduate of Southern University with his master's in business administration. So we know you're going to be spot on with this.
I appreciate it. And I might add, the only HBCU system in the world is Southern University. I just wanted to throw that out there.
There you go, man. So with that being said, I want to highlight a few different things. Very, very small portion of how the billing part works. So let's talk about if a person goes into a hospital and they literally come out with a bill. Not necessarily go into it and get a bill that day, but they get a bill 6 months down the road, which happens, right? Their insurance
that happens?
That happens.
I didn't know that happens.
Maybe it does. I don't know anyone that ever happened to,
I was
right?
about to say, I'm still pretty sure this urgent care bill for $250 I got.
Yep.
And they told me good luck. I'm still mad at that.
So let's talk about that scenario. So a person goes into a hospital and or a system, gets services, comes out, gets a bill 6 months later. Whatever the bill may be. That bill is now not paid. Whose responsibility is it at that point?
It's the patient's.
Okay, most people think that. The patient should pay it, but the patient says, I'm not going to pay it. So then what happens?
Then it goes to collections.
Usually. This is the thing that people miss. So what tends to happen in these actual systems, and this is going into the weeds here, patients often have a bill. If they can't pay it, the hospital, the doctor's office, the urgent care now has to basically turn into a collections agency. So by them turning into a collections agency, they have to actually almost go after people like a bank. So they almost seem like predatory lenders. Now, why are they predatory lenders? Because again, the insurance company, who often you would think would cover the majority or most, if not all of the things that you've been paying into a premium for a year or some change or even more than that, the insurance may only cover 30%. So that 70% that's not paid is now your responsibility. And then if you don't pay it, the hospital now has a 70% gap.
Right.
They now have to try to get 70% from you because the insurance is not going to contribute. And now they're upside down in terms of their cost and their expenses and everything else. By them being upside down, they now have to turn into a predatory lender to try to collect their money. And if they can collect, because again, there's a lot of legislation out there floating that says we can't go after people for medical debt because it's basically something that is starting to become illegal. So it doesn't get reported to the creditors as much as it used to. It doesn't necessarily get collected. So now they just have 70% gap in that actual amount they're supposed to actually be paid. So that's one person. Do you think that happens quite often or a little bit?
I think that happens a lot.
Okay, so when it happens a lot, what do you think happens at the hospital now that we can't get the money from the insurance? The patients can't pay. We don't necessarily want to be predatory lenders and have to go after you and send you to collections and mess up your credit because, again, we're in the business of giving care. We want to be nice, but we also got to run our business, right? So what happens when I don't get money from people and I'm upside down? What happens to the prices?
They go up.
They go up.
They go up because the thing about it is you have to balance or you have to cover your risk.
You have to,
right?
Right. So does that risk seem like a normal everyday risk or does it seem pretty astronomical if it's a system where, again,
it's an everyday risk because the thing about it is, especially in a hospital, right? You probably can control it a little bit more in the clinic.
Correct.
But if something happens to you catastrophically, that's something that you don't plan on doing. And some people go to the hospital and have like routine procedures, I guess, or something that you might plan a surgery for, like an orthopedic type of surgery, right? But for the most part, you go to the emergency room, you have like life-saving surgery. Like that's something that you didn't plan on.
Exactly.
And I'm pretty sure that happens a lot. And if you didn't plan on it, 9 times out of 10, you're not financially able to take care of it.
Yeah.
And then when you get the bill in the mail, I can see a lot of people who ain't got it.
Yeah. Well, they didn't have it before. What makes you think they're going to have it now? They don't have it. So now.
And then let's be honest, the people who are going to the emergency room or the people who, like, I'm not talking about like car accidents, or I'm not talking about like freak accidents, anything like that.
Yep.
But the people who are going to the emergency room as a method of an emergency, when you're talking about sickness and things of that nature, probably didn't have the means to take care of themselves from the beginning.
Correct.
So now they going into the emergency room as a last resort, and they didn't have the money.
Yeah.
So now, you think the hospital's going to collect on that?
Yeah.
There's no way.
It's damn near impossible, if at all, right? And I say that to say, the idea is people are thinking, well, look, these people are getting these big bills because they're going to get life-saving surgery. No, these people are getting bills from going to the emergency room to get checked out for a chest pain that happens to be not a heart attack. It's just chest pain. We have to do a lot of evaluations, right? To make sure you're not having a heart attack. That costs money.
A lot of money.
A lot of money. That money then comes to the person that bill comes to the person after the insurance has to quote unquote pay their part. The insurance pays the part that they say they're going to pay. And then depending on the actual insurance, they send the bill to you. When they send the bill to you, the patient, you then have a choice to pay it or not. If you don't pay it, then again, the hospital or the clinic has to collect on that debt. By the hospital or the clinic having to collect on that debt, if they don't collect on it, they're upside down. And now, by them being upside down in their finances, they have to make a decision on either A, limiting care. I can't keep giving this stuff out for free.
Facts.
So I'm not going to take these kind of patients anymore. Then they also have to say, am I going to raise prices? And most people in healthcare will do what? Raise prices when you are in debt and you have to make up for a loss that you're never going to recover.
Right.
So when you have these administrators in the insurance sitting back and saying, hey, we're not going to cover stuff, or we're only going to cover part of it, or we're going to deny some of it because even though that we should cover it, it didn't meet the criteria, so we're going to deny it. They're keeping the money, pocketing $25 billion. The person who went to the hospital for their chest pain is now getting a bill. They're possibly getting their credit messed up. The hospital system is still having a debt that they can't collect on, and then they have to raise prices. So when the hospital raises prices, what do you think the insurance company does to potentially cover that price?
They also raise
prices. So that's
cover less.
Or cover less, right? So it basically is a system that works in a very weird way, but it seems to work exactly like you want. The hospital raised their prices, so in order for us to cover this, we have to raise our prices. But you didn't cover it in the first place, and when you didn't cover it in the first place, everybody starts to have this trickle-down effect of having problems. And the trickle-down effect really oftentimes doesn't affect the insurance company because they got their money first, right? They got paid by you with the premium, and then they have to hold the money and decide to reimburse the hospital a certain amount. Then from however much they reimburse the hospital, the rest falls to the patient. That's pretty much how it works 90 to 95% of the time. Rarely does the insurance cover everything outright and you never have a bill on the back end. So when that happens, hospitals and clinics go upside down and they now have to make decisions on what insurance will they take or not, what services will they offer or not, how much will they charge, are they going to raise prices, and how many people can they see. After a certain while, that's when the hospitals and the businesses literally go out of business. And that's why people were surprised when a hospital closes because they think they make a lot of money, but really they don't, because if they have a lot of debt that they can never collect on and the insurance doesn't actually pay out, it literally just turns into them trying to get back into the green. Yeah. And they stay in the red.
And think about the effects, outside of just them closing. Like, think about all the steps, because, again, it's not just a hospital, it's a business, right? So what's one of the first things like business owners do when you're not making as much money as you think you are making? That's a business owner. You cut staff.
I was going to say, if you have staff, you definitely start laying people off.
You're right. So having a hospital and you laying people off, what does that do? That affects the ability to give care. So if you have an emergency room in that area, now you have longer wait times. You can't give people the quality of a service as you would have before because you're struggling to keep up because you don't have the staff, because you didn't make any money.
Absolutely.
And then all of a sudden you don't have supplies because you can't order the supplies you need. It's just a trickle down effect to where, your service to the community isn't the same either.
Absolutely. And I think the next part that you mentioned is that it affects the ability to give care to those who need it most. When the hospital potentially started, unless there's a way for them to somehow get into a profitable state, they start losing money. And when they lose money, they have to make sacrifices. And the sacrifices often affect the patients, which then patients start having bad experiences. So they start blaming the hospital. They start blaming the people giving the care. They're saying the doctors aren't doing a good job. The nurses didn't care a lot. And a lot of it is because they're overworked. They're exhausted. They're burned out. They're not getting paid nearly as much as you think they are. The hospital isn't getting paid nearly as much as you think it is. And the person sitting back on their yacht, on their boat, on their private plane, $25 billion in profit, literally having a good time, is the insurance company. And that's the part a lot of people miss. And that's where that frustration started to actually boil over after this incident happened. It wasn't because people said, hey, we're glorifying what this guy did. A lot of people, at least the ones that I've seen, saying this is a tragedy and that should never happen for anyone to lose their life. Then they go to the next step, which is, this is what happened to me, and that frustration is palpable. I can't say I would ever go that far, but I can understand the frustration that other people have. And I hear it all the time in my exam room about the insurance did this, the insurance did that. And a lot of that is because our patients often understand a lot more in detail of how the insurance system works or doesn't work. So they know that when something doesn't happen, it's not Dr. Jasper sitting here not wanting to do it. It's not Dr. Jasper not covering it. It's not Dr. Jasper somehow making money off of what is or isn't being done. It's them having to argue and deal with the insurance company and whoever is basically going back and forth billing the insurance company. And I will add one more thing about this. The other thing that a lot of people also are surprised about is that when they go to a hospital and you find out the pricing of something within the insurance, but you then ask for a cash price, the cash price is often a lot less compared to the insurance price. So as George already highlighted, you're going to raise the price to cover the people who didn't pay their bill. So if we're raising the price on the cost, the insurance then raises its price, all of the things under the insurance model are more expensive. And people are surprised, well, why is it more expensive when insurance is actually involved and it's cheaper? Well, again, we're marking things up to make up for the losses we're receiving on that insurance plan. If that insurance plan is not paying out the way we need to, we have to make up for that cost. To make up for the cost, we're going to raise our prices for that insurance plan. The insurance plan then turns around, raises the prices for the patient.
Correct.
So then everything is more expensive with insurance. However, if I go to George and say, this MRI that you need costs this much, and I'm not going to do it until you give me my money, the price is probably a lot less because it's simple. You pay me, I do it, we're done.
Yeah.
Compared to,
and then you're getting the money. You're promised to get the money.
You're getting the money up front, and therefore the transaction is done. Rarely do people say, well, I got the MRI, I want my money back. And if that does happen, that's going to be so few and far between. It's less likely you're going to be upside down or in the red when you're dealing with this actual procedure, this MRI, this service. So when people start to pay for things directly, the rate of default goes down drastically. If things aren't being defaulted on, the business is more profitable, and you're not having all these markups for things that don't need to be marked up. So that's the biggest concept that hopefully people will say, okay, I kind of get it, because we all know someone who has had trouble getting a claim denied, something being delayed, or something being flat out just completely disenfranchising because you're saying, I have paid into this premium for all of 8, 9, 10, 12 months, and they still aren't covering stuff. And then they're asking me to pay more next year because my premium is going up for myself, for my family, for my employers, for my coworkers. Everything's getting more expensive, but my care is not getting any better. Why would I do that when there's potentially another way? And that's what we talk about in the direct primary care side. The goal is to try to make it a lot more simplified. And if it's in a simple setting where you have less red tape, less administrative costs, less headaches, less stuff being denied, less stuff being delayed, and you know how much it is up front, you're more likely to just pay that and get it done, and then that's over. So I pause for a second to ask George the question, do you have any idea what's the default rate on these hospitals when it comes to people getting a bill and not actually paying it? Do you know what the default rate usually is?
50 to 60%.
50 to 60%.
Sounds
Absolutely.
like the divorce rate in America.
In that order? So the default rate, then divorce rate, or the other way around?
Dude, I think...
Tough one, right?
Yeah, that's a tough one.
Yeah, so I think it's a coin toss. But the point is, that should tell you that maybe if instead of defaulting, we need to divorce the insurance system.
Yeah,
right?
or at least like before you look at, what you're paying for insurance, like take an accurate assessment
Correct.
Of how much
you really
coverage you really need.
You really need. Just like anything else, right?
People blindly say, hey man, I want the most expensive one. And because I want that good insurance, and they don't even take time to look at it, see what they're using, how they're using it,
what's covered, what's not, what's included, what's not, where your premiums are. No one really understands because to them it's a number that they rarely see.
Right.
And I've said this before. Whoever came up with the insurance model for healthcare, they're geniuses. And I'm not saying that because I'm trying to literally be sarcastic. They are. They found a way to get money out of your paycheck without you even noticing it. They then found ways to have you pay them every month or every other paycheck if you were paying twice a month. They found a way also to then tell the employers you have to provide this. On top of having to provide it, they've also found a way to then get in the middle of every transaction and then choose how much things should be in terms of cost, how much should be covered and what's not. And then they have also found a way to then say, we're going to raise the price every year and you can't do nothing about it. Like if any other person did that, you would say this has to be a crime. You're not only somehow dictating what can I do and what can I do. You're taking the money before I see it. You're raising the prices. I can't do anything about it. You're mandating I have to give this to people through the job. And basically, I have all the authority and the people who are spending all the money have none. It's really a very interesting system, but it also makes me just say it's a sad thing that we're not actually having that conversation more often, that this needs to change. And how are we going to change it? The employers are not coming up and saying, hey, we need to make some changes to get this insurance stuff to go down. They just say, well, it's going up. It's kind of always going to go up. We just go ahead and pay it.
So I guess I'm going to go off script. I'm going to go off road a little bit right quick. So Dr. Jasper.
Yes, sir.
Obviously the system, the average Joe can't do anything about this system. What is Dr. Jasper's advice on how to make the best of this situation? If you're a consumer and you're wanting to get the best care possible.
Yeah. So there are plenty of ways to kind of engage. So of course we do a microcosm of that. We do direct primary care. So we're on the primary care side. We're trying to, again, deliver care directly to the patient, the employer, the consumer, so they can know the price up front. They pay it, and we use insurance on the back end for big things, just like you would in the car insurance industry. You're not using it for your tire rotations. You're not using it to change your windshield if there's a crack in it. Most times you're going to pay for that up front. And then if you get into a big incident, you then break out the insurance. We're trying to do that on the primary care side. So for people who are outside of that direct primary care setting and you're saying, well, I want to figure that out, you can always start by engaging in that. But if you're saying, well, I want to look at it from an insurance standpoint, there are different types of plans that can be administered that are different than the traditional plans that you see in a marketplace or that come through an actual big insurance company. And the big insurance companies oftentimes fall under the category you'll hear say they're BUCAs, B-U-C-A-H, BUCA. So Blue Cross, United, Cigna, Aetna, Humana. Those are the BUCA plans. And those are the biggest plans oftentimes in the country. So if you're outside of that BUCA network, you may actually have ways to do insurance that are oftentimes factoring the big insurance cost on the back end. They're putting primary care in the front, primary. They're covering your cost for primary or minor things. And then the insurance comes out for big stuff. Just like if you're a homeowner, you're going to pay for all the small up-to-date maintenance. And then if you have a flood, insurance comes in at that point.
Sure.
So that would be the way to engage, is finding the insurance plans that allow you to build the primary care piece in first. It allows you to build your cost in first. And the insurance is there for the big stuff. And those plans, to give a name to it, there are things called level funded plans and self-insured plans. And level funded plans are often the plans where you control the actual spending, you control the claims, you control what's paid and what's not. Now, you're going to have somebody help you do that. So there are people called TPAs, third-party administrators, that come in and help you do that. But if Becnel Media decided to have its own insurance plan, that can be done. And now Becnel Media controls what is insurance and what isn't, rather than handing it over to a big third party and you really don't have a say-so. And in a self-funded, level-funded plan, there are different ways to keep your costs down. But most people will never do that because it's complex, right? It's easier for me to have one person who's a broker who comes in under this company, sells you a policy, tells you you don't have to do anything, you pay this much and you're done, rather than let's sit down and really go into the weeds of who spends what on what. How many people need maternity care? How many people have high blood pressure? How many people need to actually have care with a specialist? That takes a lot of time and effort, and no one really wants to do that. So it's easier to just buy something that's out of the box and you plug it in and you go, compared to let's go through the weeds and do that. But if you go through the weeds, you do the level funded, self-funded approach, you have the third party administrator, they're walking you through it, focusing on primary care, using insurance at the end, your cost goes down. And some of the third-party administrators actually give you a check back at the end of the year. At the end of the year, when you don't use your insurance, you get your money back.
Sure.
And that's tough for people to wrap their head around because no one says, so wait, if I don't use it, I get a check back from the third-party administrator because I didn't use it? Well, why wouldn't I do that all the time? Because they don't want you to do that. Why would I, if I'm pocketing $25 billion, tell you I can help you save?
Right.
Why would I do that? I mean,
That doesn't sound like a good business.
it doesn't sound like a good business person who has shareholders who need to actually do things to make their stock price go up. Like, no one's going to tell you I can literally save everybody more money, make people healthier, and then my stock price goes down. So I'm going to be CEO of the year. Like, no one's going to do that.
Correct.
So it's easier to do what most people do. Get a person, come in, sell you something, you buy it. You basically set it and forget it for a year, and then you go ahead and do the process again. That's why at the end of the year, everyone starts to see their famous or favorite brokers who sell insurance in October, November, and December. There's a famous name for this, and you already know what it's called. It's 2 words. Starts with an O, and then the second word starts with an E. Do you have an idea what we call that season?
I do not.
You do. It's called open enrollment.
Oh yeah, that's
And
right.
why is open enrollment season always at the end of the year? Because that's when they need to sell you a policy
Yep.
so it can go into effect in January.
January 1.
January 1. And then they disappear for the first 3 quarters. And then October, hey, George, how you been? I haven't seen you in a whole year.
Man, truth be told, I haven't talked to anybody for open enrollment in a very long time.
It depends on who administers your plan, though, right?
I've had to look and make the decisions for myself. Now, thankfully, I'm one of these people who take time to research and understand what I'm signing up for and understand my needs as a consumer. And I don't necessarily jump for the most expensive one.
Correct.
But I have colleagues who just, I want to be covered.
Yeah.
So I just get the more expensive one.
Correct.
They don't even look at the deductible or anything else.
Absolutely.
They just want the most expensive insurance.
Yeah, and we do that here within our practice. Now, a lot of primary care doctors who are in the traditional system don't have time to do that, right? They're seeing patients from sun up to sundown. They're seeing 35, 40, 50 people a day. They're not going to have time to really dive into insurance, have a discussion, talk to you about your premiums and deductibles. We do, and we look at that as a whole. We also work with our employers who give us access to their employees where we administer their direct primary care benefit to their whole staff and their owners. And we sit down with them and try to figure out, is level funded or self-funded planning going to be a good thing? If they don't have a reason to do that and the traditional system, the BUCA system is better, then they stick with it. And we're not upset about using insurance. We just want to use it in a way where it's not going to drive your cost up and you have bad outcomes. You're ranked at the bottom, but you're spending the most. And then somehow we just say, keep doing that. So how about we look at all options? We look at the big insurance policies and the BUCA plans. We look at the level funded. We look at the self-insured. We look at all of those and say, these are your options. Which one do you want? And if you tried, you don't like it, then you can go back to what you've had in the past, but you never know if it's going to be better unless you actually learn more about it. But that takes work. And it also takes you feeling comfortable telling someone, I need help to learn how this works. I need someone to help me understand it. I need someone to sit down and explain it. Because again, a salesperson is going to do what they do well. They sell stuff. So they're going to sell you on the idea that this is the best thing for you. Yeah, it costs more. Yeah, it's going up, but it's only going up 3%. It could have been 8%. And it makes you feel like, okay, yeah, you're right. But why is it going up if you say, well, we didn't really use it? I didn't have any accidents. None of my staff had accidents. Nobody's really getting sicker that we're aware of. Why is it so much more expensive? They don't ever want to tell you that. Now, if they do tell you, they're not going to tell you, well, yeah, we did spend 73% on administrators. I mean, that may be why it's going up. They don't tell you that.
That could help.
They're going to make you think it's the doctors and the hospitals that are getting all this money, and that's why it's so expensive. What is funny is most recently, there's another story in the news, and you may have heard this. There was a story that came out that one of the BUCA plans basically tried to put a limit on how long anesthesia would be covered.
I did see that, and that's crazy to me.
Anesthesia, which is basically what puts people to sleep during surgery, has literally a track record of basically sitting there, keeping people comfortable, keeping them sedated, keeping them alive while there's surgery going. The plan came and said that the surgeries are going too long. So we need to find a way to cut these costs. So we're going to only cover surgeries up to this amount. So if it goes beyond that, that's going to be a patient expense. And then in the follow-up article, the reason they said that that was why they wanted to do it is because the doctors were basically demanding more money. And again, as we've already talked about, even if we do demand more money, how do we get it? Because you pay the insurance company. I can't get it from you because you're paying the insurance company if I take insurance. And if I call them and say I want more money, they don't just say sure. So there's no way we can get more money without them giving consent. So that was very funny to me that they said, well, we're just going to stop paying at, and I'm making up 38 minutes. So if your tonsillectomy goes 39, that's your problem.
You got a minute.
You got to
pay a minute of anesthesia.
You need to hurry it up, right? So surgeon, I don't know what you over there doing, but you might want to hurry it up. We only got 38 seconds. Like, who comes up with this other than someone saying, I need to make this share go up. I need to get more profit because my shareholders will not be happy and I can't go on my family trip unless I get more money. So I got to find a way to either cut costs,
Jesus Christ,
to lower the price here, to lower the reimbursement there. And then again, you wake up from surgery, you now have a bill. You didn't expect the bill because you thought insurance was going to cover it. So now who has to pay the bill?
But how bad of a business model that was. Like, think about this. Now, not only did you mention something ridiculous, but you caused all kind of bad publicity.
Correct.
Like that had to have a negative effect.
It did. Absolutely.
You know, like who thought of that?
Who did? And who then said, let's go and put it into place.
That was the only way that you could have cut costs?
There's nobody in the room that says, I don't think this makes sense. Or the people who are in the room that says it doesn't make sense, are they outvoted? Do you get what I'm saying? Because you're having people sitting here making these decisions, and then somehow, some way, don't be surprised if the decision gets passed. Someone's going to approve it, and then it goes into actual effect. And then the person who's sitting there, who's getting the broker to come at open enrollment to sell them a plan, what do you think they're going to say? Well, yeah, it's going up, but that's because the hospital is charging more and the doctor's offices are wanting more. And because the hospitals and the doctors need more money, we got to raise our prices. That's not true. It's flat out incorrect. Mm-hmm. And it's oftentimes because the people making the decisions are literally the ones that have nothing to do with you and your care or the doctor administering the care. Because I guarantee you, no anesthesiologist was in that room and said, oh yeah, I think this is a great idea.
Yeah, nobody.
Let's just go ahead and cut it down to 38 minutes. Like, I mean, this is great.
Yeah,
I got other things I need to do anyway, right? Like, no one says that.
Or as a patient, you could be like, well, I don't need the anesthesia.
Right. Exactly.
Only give it to me for 30 minutes. Just deal with the other 15.
Yeah, give me the belt. Go ahead and let me bite down on it. Let me go ahead and get a swig of whiskey, and I'll take the risk. Like, no one says that, but yet these are the people that's like, we're going to do this. And you know what? A lot of times I think they think you're not smart enough to actually think this is bad, and we're going to do anything about it. I've had to tell people, if you call and talk to the insurance company, it's going to be a really lengthy process. You may talk to 14 people and barely get anywhere, but they are banking on the idea you're not going to call them. They're banking that patient zero will not call them and challenge them. They think you just going to pay the bill. And then if you don't pay the bill, it ain't their problem, because guess who goes to collections? You do.
Yeah, I do.
And then guess who literally has a horrible business, because now I have to chase you down to get the money that you owe me.
The hospital.
Because I'm trying to give care. I need to take care of my family. I need to literally help to take care of them, pay for their college, pay for my retirement, all the stuff that I need to do as a person who owns a business. But you owe me money. So now I'm the bad guy because I'm trying to get the money for the stuff that I did for you. And the third party who's outside the room is sitting there saying, well, we don't understand what the problem is. I mean, they paid their premium. That's fine with us. We paid you how much we told you we were going to pay you. Even though you may want more, we only going to pay you this amount, right? Mm-hmm. So you literally want to charge $1,000 for this MRI. Well, we're going to pay $350. Mm-hmm. So that other $650 needs to go to the patient. So we did our part. What's the problem? Well, they didn't pay me. Now I got to chase them down. You're making your profit. I'm getting nothing. The patient's kind of and sort of not really getting good care because now we're at odds. And then you're raising the prices next year because I have to raise the price because you didn't like. It's a really bad system, and that makes no sense. And I'm going to go into the last part before we slowly close out. Mm-hmm. The people who are making the decision to cut your anesthesia to a 32-minute procedure and telling you anything over 32, you got to do it, are making out like bandits. And because of that, I'm going to literally throw it to George to look into the profits that each person in some of these bucca plans made in 2023. All right. So George, I want you to go from line by line to name out not only the company, and this is us looking it up, specifically at Byja Radio, to give you an idea of how much money came into the company, and then how much did the CEO make.
So in 2023, Humana made $106.4 billion with a B. The CEO made $17.2 million.
All right, say it one more time and make sure that we're explaining what we're reading. So the insurance company has a revenue.
Revenue.
Okay, so explain again what you're saying.
So revenue that's how much they made. That's before expenses and anything else. That's just pure revenue. How much money was generated, right?
And of that, how much was the person who runs the company paid?
$17.2 million.
17.2 million for one person at one company in 1 year. And that's the same type of company that's telling you we need to cut anesthesia.
Correct.
We need to kind of shrink this down because these procedures are going too long.
Correct.
That's the people that are telling you we can't get your insulin because, look, you ain't met your deductible. So 17.2, that's one company. That's Humana. So let's keep going.
So Cigna in 2023 made $195.3 billion in revenue. And the CEO made $21 million.
21 million. So that's Cigna.
So Elevance Health.
And let me jump in. So Elevance Health is also Aetna.
Yeah.
All right. So a lot of people don't know that. It's that Elevance and Aetna, I believe, are one and the same. Now, go ahead.
In 2023, $170.2 billion with the B. CEO paid $21.9 million. In UnitedHealthcare, $371.6 billion in revenue, and the CEO made $20.9 million. So I'm gonna stop and I'm gonna ask you a question. Obviously we don't condone anything, and I feel my condolences to the CEO's family, because that's a terrible incident that occurred. But do you think these numbers are why that there's so much empathy for the shooter?
Mm-hmm. I'll say that's a piece of it. I think these numbers are it, but the experience you have personally, like you're always going to say these people are making too much money if you're not making that kind of money,
Correct.
right? Whether it's a entertainer or somebody who's in the movies, you're going to think they make too much money considering you do a different job. I'm not going to ever say, hey, you shouldn't want to make money because that's what you want to do. That's where you live in your life. You want to go ahead and do that. I agree. But the part that people are also frustrated is they're making that much, but I'm also having to scrap and claw just to get my medicine covered. My life-saving insulin, my life-saving inhaler, my life-saving cancer medicine, I cannot get it, but they're making billions and millions of dollars in different ways, and I can't even get a 30-day supply of fill in the blank. And as I already told you, the cash price is often cheaper, so I'm paying more and getting less. That's where the empathy comes from. That's what I'm literally hearing from people who come into our exam room and saying, it's unfortunate, yet I understand kind of the sentiment of why people are so frustrated. And that's something that made me say, look, it makes sense for us to talk about this on this episode because people don't have the idea of how to peel back the layers of the onion or pull back the curtain. They just know healthcare is expensive. We need insurance. It's going to go up. I got to pay for it. And that's kind of the way it is. It takes a person to stand up and say, I want to challenge this and try to find a better way for me, my family, my group, my employees, my municipality. Because if you're a government entity, you can do all this too. And believe it or not, we within the Byja system have found ways to do all of this. It's just people don't need to have us spoon feed them, but they do need us to kind of give them the intro, and that's what we're doing here. And then our next step is for them to say, come to the table, let's talk about it. If you don't go with us, that's fine.
Sure.
We're not going to be upset if you don't go with us. I'm going to continue to do business like we've been doing. And we've been doing it for 4 years and steadily growing. And we're not doing anything different than just figuring it out and trying to bring it to people in a more equitable way. If you can sit down and do that, even for 30 minutes or an hour, and it doesn't have to be all in one session, we can do it week after week until you feel comfortable. Let's go.
Sure.
But most people are okay saying, hey, United, we got United because, we always had United.
Right.
We don't know anything about United other than that's what's on our insurance card. We know it's expensive. We know they don't cover anything. We know it's going up, but we're going to stick with them.
Thanks.
Why? I have no idea. And those numbers highlight that they are not hurting for money over there. So you can continue to give them more to get less, or you can do something different. And if you choose to do something different, we're all for it. The direct primary care model is built for that. The direct care model is built for that. It allows you to know where your dollars are going, know who's getting them, know why, and then on the back end, use the insurance. If the insurance is necessary, that's when we use it. And if you use it less, what do you think happens to your cost? It should go.
It should go down.
It should go down. If I'm not using it all the time, you should possibly get a check back saying, look, you spent $10,000, you only used $2,000. We're going to give you back about $7,000. Right? We're going to keep a little bit for the work we did, but hey, we're not going to keep $10,000 when you only use $2,000 and I'm banking $8,000 and I'm going to tell you can't get no coverage.
Right.
So, I mean, that's just how I see it. You tell me your thoughts. Maybe I'm just really heated about it because I hear it all the time, and it's very frustrating for me to have patients call and say, I can't get my medicine yet because the insurance say I got to wait another 5 days. And it's weird because it's like, why?
Yeah.
Why do you only get so many pills for so many days if it's the same medicine that they've been on for 10 years and they're not doing anything other than taking it? Why not give it to them early?
Yeah.
Like, it makes no sense other than they want to keep money.
Well, and I think a lot of industries, healthcare is being one, being that we're talking about the healthcare industry, but also there's a lot of industries that take advantage of the ignorance of people.
Absolutely.
And when I say the ignorance of people, I that's not a bad word. I'm talking about just the lack of research and the lack of understanding of what you're paying for. And in my opinion, for people, the best thing that you could do to help yourself is just to educate yourself and understand what you're paying for and take a look, right? Because in all my years of telecom, it was the same thing. People overpay for bandwidth and they overpay for storage. Like for the new iPhone come out, I want the biggest and baddest one. I want the 1 terabyte. I'm like, bro, but you only got 50 gigs of stuff on your phone.
Barely 50.
Now you're spending an extra $800 on the phone that's gonna do the same thing as the phone that's $1,200. You know what I mean? Like,
absolutely.
So I just think that a lot of people make profits on people's ignorance, and as a consumer, you have to research what you're paying for. You have to understand your healthcare needs. You have to understand how often you go to the doctor. 100%. I'm not saying don't have health insurance because I have health insurance. I will make sure I keep health insurance.
Correct.
However, I pay for what I'm using it for, and I've done the SWOT analysis. As Byron said, I do have an MBA.
There you go. There you go.
I've done the SWOT analysis. I've run the numbers, and I have a solution that fits my needs the best. I use the direct primary care model for Dr. Jasper for my primary care needs, but I also have a higher deductible insurance plan because I may need to go to the hospital. I may need to go to a specialist. I may need to utilize these other things, and I'm perfectly fine with how I'm getting help and how I'm being cared for. So, long story short, understand what you're paying for. Do your research. Don't just close your eyes and say, I want the most expensive option because I want good insurance.
Absolutely. So, George kind of set us up for the closing. We could definitely stay on this for probably another hour and a half, but I'd like to highlight a few different things. So less than 8% of the total healthcare spending that we talked about goes towards doctors. And that's huge because oftentimes the doctors, the pharmacists, the healthcare delivery people are getting cast as the bad people because they're trying to collect debt on services they've offered and not being paid for it. Imagine you gave people food at a restaurant that you own and they never pay you, and then they get to keep eating. Like, it doesn't make sense, but that's the system. And because the system is so messed up, it makes the doctors look like they're the bad people for trying to stay in business. And then on top of that, they're spending more and more for administrative costs and claims and paper pushers and giving less care. And it's just going to continue unless you do something different. So if you're in any of the industries and you're listening to this, and I encourage anybody who's listened this far to share this episode with people so they can start to engage and understand that there is a better way. You have to start to educate people. And that's why we do this episode over and over on different topics, to educate people to unplug from what they think is a good system that's really, really not. And if you can do that, it allows us to start to do things differently that are more cost effective, that give better care, and it has better outcomes for people in those places that need it most. Those employers that are oftentimes working their what's off and still getting bad service, we're trying to fix that. So with that, I'm going to slowly close out. I'm going to say, if you're interested in engaging with us and you're an employer, you're a government worker, you're a municipality, you're an administrator, you're a lawmaker, give us a call, reach out to us, jump on our website, send us a message. You can find us at www.byja.org for our clinic, Byja Clinic. You can find us on the nonprofit side at Byja Charitable Alliance. That's www.byjaca.org. We're also on social media at LinkedIn, at Facebook, and Instagram. And with that, we are wanting to talk to you, have meetings with you, talk about these plans, find a way to start to save cost, give better care, have better outcomes, and prove that we can do better for the people that we are serving rather than serving ourselves. With that, George, where can the people find you?
They can find me at George_Becnel on X, formerly known as Twitter, Elon Mustang, whatever you want to call it, and at Becnel Media on Instagram. That's a good place to find me.
And sorry, I almost forgot. You have to, if you have not, check out the Byja Blueprint book. It is available on all kinds of platforms, Barnes & Noble, Apple ebook, Amazon. It definitely gives you that introductory guide to direct primary care and how and why it works, and definitely can then lead you to more of what we're talking about here on Byja Radio. So please,
and I'm in the book.
And George is definitely in the book, so that's even more reason for you to get two copies. So subscribe to our podcast, our radio show, like, share. The more you share, the more people learn, the more people start to get better health and better health care. So thank you so much for tuning to this episode. We will see you next time.